Hi, this is Mark Squires, the Medicare Whisperer. I'm located in the Kansas City area. Thanks for stopping by today. I really appreciate it. On today's episode, what I want to discuss with you is building your Medicare the right way. Now, I live in Jackson County, Missouri, and there's about 117 different ways to build your Medicare in where I live. Now, I don't know where you live, obviously. There's a different number there. It doesn't really matter. There may be more, there may be less. But here's the thing. There are enough different ways to build Medicare that it can be a little bit confusing. And like so many things in life, there's a right way to do it and a not so right way to do it. And that's what we want to talk about today. So if you've been watching my other videos, you know that Medicare Part A covers inpatient coverage, like in a hospital or skilled nursing facility, even your home in some cases. Medicare Part B, well, that covers preventive and outpatient services. Part D, of course, covers drugs, and then Part C is the Medicare Advantage plan that kind of wraps the A and B and sometimes the D into one program. We've talked about all that before. Well, outside of that four square box is something called the Medigap program. That's Medicare's official term, Medigap. It fills in the gaps in Medicare. And this is something you may want to consider using in your case, and that's what we're going to talk about. So, Medicare has holes in it. It has gaps. We know that. We have deductibles, we have copays, we have co-insurance, and a Medigap policy may be a good way to shore that up. Here's the thing. You've heard me say it more than once in these videos. All insurance exists for one purpose only, and that is to keep from being financially devastated if and when the worst happens. And that's what a Medigap policy will do for you. Now, we're shooting this video the summertime of 2019, and we're about to come on to some of the most sweeping changes in Medicare in a generation starting in 2020, and we'll shoot some other videos on that. But I'm going to talk about the way things are today while I'm in this video. Is that all right? Okay, I see you nodding. Good. So there are a number of different Medigap policies, and we're going to include a link in this video on how you can get a free download on choosing a Medigap policy for you. So we'll include that a little bit later. Most people in the past several years have discussed using F plans, G plans, and N plans. Well, an F plan is comprehensive coverage. Zero deductible, zero copays, covers everything as long as it's medically necessary and covered by Medicare. Those are about to become restricted to people who are new to Medicare here in a few months, and you've heard a lot about it, and most likely your friends who are armchair Medicare experts have been telling you all kinds of things that may or may not be accurate, and we're going to talk about that in another video. But F plans currently are available. They're expensive, and we're seeing the premiums on those go up, up, up dramatically. Premium increases as high as 19%. Next door to the F plan is the G plan. And the G plan is a lot like the F plan, except for the owner of the policy is responsible for their own Part B deductible. Remember, B is outpatient. Medicare Part B currently has an annual deductible of $185 as of the time I'm shooting this video. There's another policy or plan called the N plan, N like Nancy. Looks a lot like the G plan. You still have to pay your own Part B deductible. It's $185 a year as I'm shooting this video. It doesn't cover balance billing or overage charges. Certain providers can contract with Medicare in such a way that they can balance bill the patient up to 15% above Medicare's reimbursement rate. And on an N plan, when you go to certain doctor's visits, you may have a copay of up to $20. Okay, so why am I saying this? Because I know what you're saying. I don't want to deal with copays. All the time I was on insurance with my employer, I had to deal with copays, and I don't want to deal with copays. I understand. But let's talk about this. We want to protect your money, we want to protect your stuff, and we want to do it in the most efficient way possible. And that might be an N plan. See, the difference in premium where I live, maybe not where you live, but where I live, that difference in premium between an F and an N, it's about $90 a month. Between a G and an N is about $60 a month. Well, think about that. You'd have to go to the doctor 30 times a year to break even. Not a bad deal. You might want to consider going with an N plan. If you have additional questions on this, feel free to reach out to me through the website, lifewithmedicare.com. Or you can give us a call at 816-841-9141. I don't want to go too deep into the weeds with this because there's no such thing as one size fits all. We have to figure out what's right for you. What I do want to focus in on for the last couple of minutes of this video is, remember, we're protecting your assets, we're protecting your money and your stuff. And this is a little bit of a confessional for me as a Medicare plan broker. We're paid on commission. And believe it or not, a Medicare broker in most cases is paid more commission on a Medicare Advantage sale than they are on a Medicare Supplement sale. So if you're talking to me or you're talking to one of my brokers who works for me or wherever you're at and you're talking to a broker and they're recommending going with a Medicare Supplement policy over Medicare Advantage, even though that Medicare Advantage might have a $0 or $20 premium, they're not doing it to drive their commission up. In fact, they'll make less money if you buy the Medigap policy than they will if you buy the Medicare Advantage plan. So think about that. Get it done right, build it right, ask lots of questions. I want you to stick around. We've got another video coming right after this. If you'll stick around or click on the link that you're about to see, you'll be able to watch it immediately. Again, this is Mark Squires, the Medicare Whisperer in Kansas City. Thanks for stopping by. We'll see you again soon.